The question has been asked, how will McDonald Dick be remembered in the field of pediatric cardiology? To me, the answer is an easy one. Mac will be considered the Ann Landers of pediatric cardiology. Now, for those of you who are a little on the young side, you may not remember Ann Landers, which was the pen name of twins who wrote an advice column in the newspapers in the middle part of the last century. These ladies provided prompt and useful advice in response to letters to the newspaper on all sorts of topics related to etiquette, behavior, and personal comportment. And to me, Mac exemplifies how a pediatric cardiologist should act. Here are some examples from my own experience with Mac and what he has taught me. Perhaps the first lesson related to punctuality. On my very first day as a pediatric cardiology fellow, we were invited to Dr. Rosenthal's for a party. Mac, in full consideration of the starting time of the party, which was 7 p.m., kept Robert Campbell, his electrophysiology fellow, in the cath lab until 9 p.m., teaching him how to measure intervals from an electrophysiology study. He and Robert arrived at the party at 9:30, wondering why dinner had already been eaten. Another early example provided by Mac related to attire and dress. A question one might ask is it important to wear underwear underneath scrubs when you're in the cath lab? One quick look at Mac provided the appropriate answer: no. A third key aspect about Mac's personality was his deep love for animals. In the clinic with Mac, patients were often referred to as with appellations such as cooked goose, blue as a squid, or doorstop. Now, what might these refer to? Well, again, the angiographic definition of an AV canal defect related to the so-called gooseneck deformity that you could see on the angiogram. Therefore, a cooked goose was a Downs that had pulmonary vascular disease. Blue as a squid referred to a patient who had inoperable cyanotic heart disease, and doorstop referred to a patient who had severe neurologic injury. These types of terms again demonstrated Mac's ability to care. One brief episode in my life, after I was a fellow, showed how Mac could both care for others and demonstrate his remarkable frugality. I was speaking to Mac on an issue unrelated to a cardiac meeting, but 2 weeks before the Heart Association. Mac then asked me if I was going to the meeting, and I said yes. He informed me that he did not have a room as yet, and it was really important that he go because he was introducing Dr. Roberta Williams for an important lecture. I said, well, Mac, I can change my reservation from a king-size bed to a double bed, and then you can stay with me. That was very appreciative, and Mac stayed with me for 2 nights. Of course, I paid for the room. This then demonstrated to me the virtue of frugality. How about caring for others? Well, it turned out that Mac's flight left about 6 in the morning, and there were no limos, so Mac simply took the key from my rental car and took it to the airport, turning it in for me. Again, demonstrating his caring. However, I still needed to get a limo to the airport 2 days later. Finally, I would like to say that Mac has always been an inspiration for me, and I would like to make a toast to Mac as the Ann Landers of pediatric cardiology, a post I'm sure that no other pediatric cardiologist in history will ever aspire to. Thank you, and bye-bye. Okay. Love you, Mac. Is that it?
Thought it was good to roll.